Welcome back. Whether you have family history or not, most people hope to avoid Alzheimer's or dementia. Research has found for older adults who are at risk of dementia, hearing aids can help slow down memory loss by 48%. That's a big number considering 48 million Americans suffer from hearing loss and nearly 6 million are dealing with some form of dementia. The study found that if treated with hearing aids, the risk of dementia was decreased over a 3-year period. So this is a huge finding. This has many people in the hearing aid industry talking. Joining us now, audiologist from Associated Hearing Care with Beltone in St. Paul. We have Dr. Your name is escaping me, Dr. Rebecca Younk. I'm getting the two of you confused. And also with patient Leah Beno. Thank you so much for joining us. We appreciate it.
Pleasure to be here.
Doctor, I'll start with you. Dive a little deeper into the details of this study. And are you seeing more people want to come into your practice, inquire about this, and maybe sign up and actually get hearing aids?
Absolutely. So we've known for about 20 years that there's an association between hearing loss and long-term cognitive decline and dementia. This is the first study that has shown that our intervention will help slow that cognitive decline. And like you said, it looked at adults in this study that had hearing aids and those that did not, and it looked to see how that technology interacted with their brain. And what they found is older adults that are more at risk of developing hearing loss had a 48% reduction in that decline. And that's so important because we just want people to stay healthy and happy and active with their family and loved ones.
And obviously, Lisa, this is something very personal for you. You lost your father within the past year, and he was dealing with both Alzheimer's and hearing loss. Talk a little bit about him and just what you saw firsthand.
Hi, Leah. Thank you very much. The really great thing about this study is it's kind of proved conclusively things that I already thought that aren't healthy for older Americans as they reach an area where they may have a cognitive decline and have hearing loss. My dad's hearing loss, I think, came about his late 60s, and he was starting to already get a cognitive loss at that point. And one of the things that I thought was so important in the study when I read it was that older Americans who are starting to get a cognitive loss but also have an extreme hearing loss, they start to isolate themselves from people. And my dad, because he couldn't hear and was having trouble getting things from the back of his brain to the front of his brain because of the cognitive decline, would isolate himself even more. And so it's so important with that respect to get your hearing checked and make sure you're all right, and start thinking about your future and how you're going to deal with what may or may not happen.
And he was 83?
He was 83.
And how long did he have hearing aids?
I would say just under 20 years.
Okay.
Yeah, it was his late 60s when he got his first hearing aids. His late 60s, not the late 60s, and he died last December at 83. So maybe 15 years, 15, 16 years.
What's the average age that you're seeing of patients now? Because in one breath, we know people that, oh, you know, I'm 40, I'm having a little problem, I get right in there. Others are still reluctant to get hearing aid just for whatever, you know, associated with getting old or whatever personal reasons it might be.
I would say before this study, it was the older adults that were 60, 70 were coming in to get their hearing checked. Now we're seeing working adults coming in because they're concerned. They want to take care of their health, and they're coming in to get baseline hearing tests and to talk to us about intervention and communication strategies. So we're definitely seeing more and more younger adults in their 40s and 50s coming in to at least get a baseline and have a conversation with us about how to have healthy hearing.
Yeah, something to think about, whether it's for you or maybe your loved one, if you're seeing some of these signs. Right.
Absolutely.
Dr. Rebecca Younk, Lisa, thank you. We appreciate your time this morning.
Thank you so much,
very
Leah.
much.
Have a great day.
Thank you.